All right, let's jump into a deep dive on something that, well, might not sound super exciting at first glance, but it's really important. Recovering from knee surgery.
Yeah, not exactly a beach vacation.
Uh-huh, exactly. But trust me, we're going to uncover some really practical tips and tricks to help you get back on your feet and moving smoothly.
That's right. It's all about making that recovery journey as smooth as possible.
Think of this as your personalized recovery roadmap. We're going to guide you through managing pain, smart exercise strategies, and even long-term tips to keep those knees happy for years to come.
We'll break it all down into three key stages: inflammation, proliferation, and remodeling. Each stage has its own challenges and milestones.
Okay, so a roadmap to recovery broken down into three key stages.
That's the plan. And remember, even though every recovery journey is a bit different, understanding the basics can make a world of difference.
I like that. The basics. So before we get into those stages, let's understand why that knee might still be talking back to you even after the surgery is done.
Right. It's important to remember that pain after surgery isn't always a bad sign. It's actually a natural part of the healing process.
So it's not necessarily something to worry about.
Exactly. It's your body's way of saying, hey, we're working hard here to repair those tissues.
So it's more like a sign that things are working the way they should.
Precisely.
But I imagine the speed of recovery varies from person to person, right? Like some people bounce back faster than others.
Absolutely. There are a few factors that come into play. The type of surgery you had, your overall health going into it.
Right, makes sense.
And a really big one is how closely you stick to your rehab plan. Rehab is truly where the magic happens.
Okay, rehab is key. We'll definitely dig into that in more detail. But first, let's paint a picture for our listeners. Imagine you're fresh out of surgery, maybe feeling a bit sore.
Yeah, understatement of the year, maybe.
Haha, probably. So pain management is definitely top of mind. What's the first line of defense in those initial weeks?
You've probably heard of the RICE protocol: rest, ice, compression, and elevation. It's a classic for a reason.
RICE. Okay, let's break that down. Rest seems pretty straightforward, but why is it so crucial?
Well, when you rest, you're giving your body a chance to focus all its energy on repairing those tissues.
So it's like giving your knee a break so it can do its job.
Yeah, exactly. Without being strained by extra movement or activity.
So no matter how tempting it is, maybe hold off on that post-surgery victory jog.
Definitely. Now let's move on to I for ice.
Okay, ice. We all know it's the go-to for injuries, but how does it actually work? Is it really doing anything besides numbing the pain?
Ice does more than just numb the area. It actually constricts blood vessels, which slows down the flow of fluid into the injured area.
So less swelling.
Exactly. Less swelling means less pain.
Okay, that makes sense. What about compression? Those compression sleeves I see everywhere, are they actually helpful?
They can be very helpful. Compression works kind of like ice, gently squeezing those blood vessels to limit excess fluid. Plus, it gives your knee some extra support, which helps with stability and can even help with pain.
Like a reassuring hug for your knee.
Exactly. And then we have E for elevation. This one is easy to forget, but it's really important.
I'll admit, I've been guilty of that myself. Why is propping up that leg so important?
When you elevate your leg above your heart, it helps drain excess fluid away from the knee.
Oh, so gravity is our friend here.
Exactly. It encourages those fluids to flow back to the circulatory system.
Okay, so we've got RICE all figured out. Now let's talk pain meds. I know it can be tempting to pop a pill and silence that throbbing, but I've heard there can be downsides to relying too heavily on pain medication.
You're right. There's a delicate balance when it comes to pain meds. They're definitely important for managing discomfort, especially in those early days.
Right, but there's a catch.
Yeah, the thing is, overusing them can actually slow down your recovery.
Wait, really? Why is that? Wouldn't less pain mean you can move more and heal faster?
It might seem counterintuitive, but pain is actually your body's way of telling you something.
Like a signal that something's not right.
Exactly. It's telling you to take it easy, that you might be pushing yourself too hard. If you constantly mask that pain with medication, you might miss those important cues.
And potentially injure yourself further.
Exactly. So it's all about finding that balance between managing the pain so you can function.
But still being able to listen to your body.
Precisely. You want to be comfortable enough to participate in your rehab, but not so numb that you ignore your body's limits.
Okay, so it's a bit of a dance between pain relief and respecting those signals your body is sending.
I like that analogy. It's a dance.
Now, besides RICE and being mindful of pain meds, what are some other tools that can help in those early stages?
Things like braces, compression sleeves, which we already talked about, and crutches can be really helpful.
Yeah, they can take some of the pressure off.
Exactly. They act as your knee's support system, letting it rest and heal properly.
So let's talk about braces first. What do they actually do?
Braces help stabilize the joint, preventing any unwanted movements that could strain those healing tissues.
So they're especially important after certain types of surgeries?
Yes, exactly. Like an ACL reconstruction, where limiting movement is really important for proper healing.
Okay, that makes sense. What about crutches? They're not exactly the most stylish accessory, but I guess they serve an important purpose.
Uh-huh, yeah. Crutches may not be a fashion statement, but they're crucial for offloading stress from the knee.
So you can still move around without putting your full weight on it.
Exactly. That's especially important in those early stages when the tissues are still fragile.
Got it. Now, what about things like massage or electrical stimulation? Are those helpful early on?
They can be. Gentle massage done by a qualified therapist, of course, can help with muscle stiffness and promote circulation. And electrical stimulation, like TNS units, can help interrupt pain signals.
Ah, so they can provide temporary relief.
Right. It's not about magically erasing all the pain, but managing it and keeping things moving gently.
Okay, that makes sense. So we've talked about managing pain and giving the knee that extra support, but I know everyone's itching to hear about exercise. What can you actually do in those first few weeks after surgery? I'm guessing it's not quite time for squats and lunges.
You're right. Heavy lifting is definitely off the table for now, but gentle movements are really important, even in this early phase.
Really? I would thought rest was the most important thing.
Rest is important, but think of these gentle movements as a way to slowly wake up those muscles and joints.
So it's not about building strength just yet.
Not yet. It's about promoting circulation, preventing stiffness, and maintaining some basic mobility.
So what kind of exercises are we talking about? What are some examples of those early knee-friendly movements?
One of the simplest but most effective is ankle pumps.
Ankle pumps.
Yeah, you just lie down with your leg extended and repeatedly point your toes up and down.
That sounds doable even right after surgery.
Exactly. And even though it seems simple, it's really effective for improving blood flow in your lower leg, which in turn helps reduce swelling and the risk of blood clots.
Wow, I never realized something so simple could do so much. What else can we do in those early days?
Another great one is quadricep sets. Lie on your back with your leg extended and gently tighten your thigh muscles like you're trying to push your knee down towards the bed. Hold for a few seconds, then release.
So it's a subtle way to activate those quads without putting any stress on the knee joint itself.
Exactly.
Okay, what about regaining flexibility?
Heel slides are your friend for that. Lie down with your leg extended and slowly slide your heel towards your buttock, bending your knee as much as is comfortable.
Okay, that sounds gentle enough.
It is, and it helps prevent the muscles around your knee from getting too tight.
Got it. So we've got ankle pumps for circulation, quad sets for muscle activation, heel slides for flexibility. Anything else?
One more. It's important to do some patellar mobilization.
Patellar dot what?
It basically means moving your kneecap. With your legs straight, gently use your fingers to move your kneecap from side to side and up and down.
Oh, interesting. What's the purpose of that?
It helps prevent scar tissue from forming around your kneecap and limiting its movement.
So keeping everything loose and preventing it from getting stuck.
Precisely.
Okay, so those are the early exercises. They seem simple enough, but I guess they lay the foundation for a good recovery.
Exactly.
All of this is great information, but I'm kind of eager to hear about when we can start building strength back. You know, when it starts to feel a bit more like a real workout.
I hear you. And that's exactly what we'll cover next. We'll explore the strengthening phase of recovery, from weeks 6 to 12 post-surgery, and talk about the exercises that will help you reclaim your strength and stability.
Okay, stay tuned, everyone. We're just getting started. All right, welcome back to our deep dive into all things knee recovery. We're now moving into weeks 6 to 12 post-surgery.
Yeah, that's right. We're shifting gears a bit now.
I'm ready to level up.
It's time to start focusing on building strength.
So what's happening inside that knee during this phase? Is it all healed up by now?
Well, not completely. The initial inflammation has probably calmed down,
Okay, yep.
and your body's busy building new tissue. But it's still fragile,
Right.
so we have to be careful how we approach strengthening.
That makes sense. We don't want to undo all that hard work the body's been doing.
Exactly. So in terms of exercise, we're moving away from those really gentle movements
Yeah, okay.
and starting to introduce exercises that actively challenge those muscles.
So what kinds of exercises are we talking about here?
Things like straight leg raises, Mini squats, step-ups, maybe even some stationary cycling.
All right, it's starting to sound more like a workout.
Yeah, a little bit more challenging.
When you say squats, are we talking those deep squats I see people doing at the gym?
Not quite. We'll start with mini squats, just focusing on a slight bend in the knees.
Mini squats, okay.
So stand with your feet, shoulder width apart. Lower yourself like you're sitting in a chair, but only go down a few inches. Hold for a second, then stand back up.
Like a little baby squat.
Yeah. It's all about gradually increasing the challenge as your muscles get stronger.
Okay, I like that. What about street leg raises? Those sound pretty self-explanatory.
They are.
Yeah.
You lie on your back with one leg straight, the other one bent,
Okay.
and then you slowly lift that straight leg about 12 inches off the ground. Hold for a few seconds, then lower it back down.
Simple but effective, I'm guessing.
Definitely. Straight leg raises are excellent for strengthening your quads, those muscles at the front of your thigh.
Okay,
And they're still pretty gentle on the joint itself.
got it. So building strength without putting too much pressure on that healing knee.
Exactly.
All right, next up, step ups. I'm picturing those little steps they have at the gym.
Those are perfect. Find a step that's a comfortable height and just step up with one leg, then back down. Alternate legs with each step.
Sounds pretty basic.
It is, but
Yeah.
it's great for starting to introduce those functional movements that we use in everyday life.
Like climbing stairs.
Exactly. And it also helps improve your balance and coordination.
Which is important after surgery, I imagine.
It is. Your balance can be a bit off after knee surgery.
Makes sense. Okay, what about stationary cycling? I'm a big fan of biking.
Stationary cycling is fantastic because it's low impact and gentle on your joints, but it still gives you a great workout.
So it's good for building endurance.
Yes, and for improving range of motion in your knee.
I like it. Now, you mentioned earlier how important it is to have the right form when you're doing these exercises.
Oh, yeah, absolutely. That's super important during the strengthening phase.
Why is that?
Because as you start challenging those muscles, it's easy to push too hard or slip into bad habits.
Which can lead to re-injury.
Exactly. For example, let's say you're doing those mini squats and you try to go too deep too soon.
Yeah.
That puts extra stress on that healing joint, and you could actually damage those new tissues that are forming.
So slow and steady wins the race.
That's a great way to put it.
Better to do fewer reps with perfect form.
I totally agree.
And I guess this is where working with a physical therapist or a trainer can be really helpful, right? They can make sure you're doing things correctly.
Oh, absolutely. They can guide you through the exercises
Yeah.
and help you adjust the intensity as you get stronger.
Speaking of getting stronger, let's talk about what comes after these first 12 weeks. What does the advanced recovery phase look like?
This is where things really start to feel like they're coming together.
Okay, good.
You should be feeling stronger, your range of motion is improving, you're getting back to a more normal routine.
Sounds promising. But we're not done yet.
Not quite.
All right, what's next? What kind of exercises are we doing in this advanced stage?
Now we can start introducing things like lunges, leg presses, and glute bridges.
Okay, lunges. I've always had a love-hate relationship with those.
I get it.
What's the proper form for lunges, especially after knee surgery? Anything specific to keep in mind?
Definitely. With lunges, it's all about balance and control. Step forward with one leg, keeping your back straight and your core engaged.
Engaged core. Got it.
Lower your body until both knees are bent at a 90-degree angle.
Okay.
And make sure your front knee doesn't extend past your toes.
Right, that's important.
Then push back up to the starting position and repeat with the other leg.
And what are we gaining from doing lunges at this stage?
Lunges are fantastic for strengthening your quads, hamstrings, and glutes.
Those are all important for knee stability.
Exactly. And they're also great for improving balance and coordination.
So lunges are like a multitasker for knee recovery.
You could say that.
All right, what about leg presses? I remember those from my days at the gym.
Leg presses are a great way to build leg strength in a controlled environment. You sit on the machine with your feet on the platform and just push the weight away from you.
Okay, and then slowly lower it back down.
Right. The key is to use a weight that's challenging, but doesn't force you to compromise your form.
So start light and gradually increase.
Exactly. And those movements should always be slow and controlled.
No jerky movements.
Yep, not yet.
All right, we've got lunges and leg presses covered. What about glute bridges? Those always look easy, but I know they can be deceptively challenging.
They are. Glute bridges might look simple, but they're so effective for strengthening your glutes.
And strong glutes are important for knee health?
Yes. Strong glutes help stabilize your pelvis, which in turn improves your knee alignment and reduces strain on the joint.
So it's all connected.
Everything's connected.
All right, so we've got our strengthening exercises. What else is important during this advanced recovery phase?
Now's a good time to start thinking about proprioception and balance training.
Proprio what?
Haha, I know. It's a mouthful. But basically, it's your body's awareness of its position in space.
Okay, that makes sense.
And after surgery, that awareness can be a bit off, which can affect your balance and coordination.
So it's like your brain and your knee need to reconnect.
Yeah, exactly. They need to get back on the same page.
So how do we train that?
Exercises like single-leg stands and balance board drills are great for retraining that brain-knee connection.
So just standing on one leg.
Yeah, it can be that simple.
Yeah.
Stand on one leg for as long as you can comfortably hold it. And then as you get better, you can make it more challenging by using a balance board or even closing your eyes.
Wow, that sounds tough. But I guess it makes sense. Why is this balance training so important, especially after knee surgery?
Good balance and proprioception are really important for preventing falls and re-injury.
Okay, so that makes sense.
It helps you react more quickly to changes in terrain or unexpected movements, which protects your knee from further damage.
So it's not just about strength, it's about regaining that sense of control and stability that we often take for granted.
Exactly.
Now, for those listeners who are athletes or just really active people, is this when we can start thinking about getting back to sports and those more high impact activities?
That's right. If you're eager to get back to those more demanding activities, this is where we start incorporating sports-specific training.
Okay, so for those listeners who are itching to get back in the game, what's your advice?
I would say it's crucial to work with a qualified professional, like a physical therapist or athletic trainer.
Okay.
They can assess your individual needs and design a program that's safe and effective for you.
So it's about tailoring the training to your specific goals and making sure your knee is truly ready for those higher impact activities.
Precisely.
We've covered a lot of ground, from pain management to advanced exercises, but I know recovery isn't always a smooth ride. What are some of the common challenges people face along the way?
Oh, absolutely. It's rarely smooth sailing all the way. Things like persistent swelling, mental barriers, plateaus in progress, those are all common hurdles.
Yeah, those setbacks can be really frustrating. Let's talk about how to deal with them, starting with swelling. What can you do to combat that stubborn swelling that just seems to linger?
Compression wraps or ice baths can be really helpful.
Okay.
Compression helps to squeeze out excess fluid, while ice constricts the blood vessels, which reduces inflammation.
So a 1-2 punch for swelling. What about those mental barriers? Recovery can be tough mentally as well as physically. What advice would you give to someone who's feeling discouraged?
It's easy to get discouraged, especially when progress feels slow or you hit a setback.
Yeah.
But it's important to remember that healing takes time.
It's a marathon, not a sprint.
Exactly. And everyone's recovery journey is unique. Setting realistic goals and celebrating those milestones, no matter how small, can really help. And don't underestimate the power of connecting with others who are going through a similar experience.
Yeah, finding that support system.
Exactly. Support groups, or even just talking to friends and family can make a huge difference.
It's so important to remember that you're not alone in this.
Absolutely.
Okay, what about plateaus? What do you do when progress just seems to stall?
Plateaus are totally normal, so try not to get too discouraged when they happen.
Easier said than done sometimes.
I know. But often, a plateau just means your body needs a little change. Maybe try modifying your routine, increasing the challenge, or even just talking to your physical therapist.
So they can help you break through that plateau.
Exactly.
It's about listening to your body and adjusting as needed.
Right.
We've covered a lot in this episode, from those early days after surgery to more advanced exercises. But what about life beyond the immediate recovery phase? What can people do to support their knee health in the long term?
That's a great question. Recovery doesn't just end when you finish physical therapy. It's about incorporating those healthy habits into your everyday life.
So it becomes a lifestyle change.
Exactly.
What are some of the key things people should focus on?
Maintaining strength and flexibility, managing your weight, and following an anti-inflammatory diet are all really important for keeping your knees healthy.
Okay, so let's break those down. Maintaining strength and flexibility sounds simple enough, but how do you actually do that?
Continuing those targeted exercises we've talked about, even after you've fully recovered, can really make a difference.
So don't just stop once you feel better.
Nope. It's about staying consistent.
Got it. What about weight management? Why is that so important for our knees?
Think about it this way. Every extra pound you carry puts additional stress on your joints.
Especially the knees, I imagine.
Exactly. So, maintaining a healthy weight can really help protect your knees from wear and tear.
Makes sense. What about an anti-inflammatory diet? I know that's good for overall health, but how does it specifically benefit the knees?
Well, inflammation is a natural part of healing,
Right.
but if it becomes chronic, it can actually contribute to joint pain and damage over time.
Okay.
So following an anti-inflammatory diet can help keep that inflammation in check.
So what kinds of foods are we talking about here?
Think fatty fish like salmon and tuna, colorful fruits and vegetables, leafy greens, nuts and seeds, bone broth. Those are all great
So
choices.
lots of nutrient-rich foods.
Exactly. Foods that help nourish your body from the inside out.
Love that. Now, besides diet and exercise, are there any other lifestyle tips you'd recommend for happy knees?
Low-impact activities like swimming, cycling, and yoga are all great options.
So even activities that don't directly target the knee can be beneficial.
Absolutely. They help promote joint health and overall fitness without putting too much stress on your knees.
It's all about finding those enjoyable ways to move your body.
I agree.
We've talked a lot about what to do to support recovery, but it's equally important to know what to watch out for. What are some of those red flags, those signs that something might be wrong and you need to see a doctor?
That's a really important point. While some discomfort is expected during recovery, there are definitely some warning signs you shouldn't ignore.
So give us the rundown. What should we be looking out for?
If you have pain that just won't go away, even with rest, that's a sign that something might not be healing right.
Okay, so persistent pain is a red flag.
Definitely. Also, if you notice swelling, redness, or warmth around the knee, that could be a sign of infection.
Okay, those sound like things you wouldn't want to ignore.
Exactly.
Yeah.
And if you're unable to bear weight or have a lot of difficulty moving your knee,
That's a sign to call the doctor.
yes, it's always better to err on the side of caution.
So it's about paying attention to those signals your body is sending and not ignoring anything that feels off.
Absolutely. Early intervention is key.
This has been so informative. Can you give us a quick recap of the key takeaways so far?
Sure. We've talked about how important it is to understand the healing process, how to manage pain effectively,
Right.
and how to gradually increase strength and mobility through targeted exercises. We've also touched on the importance of those long-term lifestyle habits that can support knee health.
So it's a journey from pain management to strength building to regaining full functionality and maintaining that progress.
That's a great way to put it.
And remember, everyone's recovery is different. It's about listening to your body, working closely with your healthcare team, and celebrating those milestones along the way.
Couldn't agree more.
Now, as we wrap up our deep dive into knee recovery, I want to leave our listeners with one final thought. We've covered so much ground today, from those very first steps after surgery to building long-term habits for knee health. But as we wrap up, I'm curious, how can we apply these lessons to everyday life even when we're not recovering from surgery?
That's a great question. We often take our knees for granted until something goes wrong.
Yeah, totally.
But if we could shift our thinking and start being more proactive, incorporating those strengthening exercises, focusing on flexibility, making smart choices about how we move.
It's about preventing those problems in the first place.
Exactly. And it doesn't have to be a huge overhaul. Small changes can make a big difference.
This has been such an eye-opening deep dive for me. We've gone from understanding why we have pain after surgery to learning all these different recovery strategies.
Aw.
From those initial gentle movements to building strength and stability.
And then those long-term habits to keep our knees happy.
It's a whole journey.
It is. It's a journey, not a race. And every step, every effort you make brings you closer to that goal of moving freely and enjoying life.
I love that. It's about progress, not perfection. And it's important to remember that you're not alone on this journey.
That's so true.
There are resources out there, people who can guide you, and a whole community of people who have been through it and come out stronger on the other side.
So keep moving, stay informed, and trust the process. You'll be glad you did.
That's a great note to end on. And that's it for our deep dive into knee recovery. We hope you learned something new and feel ready to tackle your own recovery or maybe just support your knee health in general.
Thanks for joining us.
Until next time, stay curious and keep exploring.